When it comes to managing pain, Vicodin is a popular choice for many. This powerful medication contains a combination of hydrocodone and acetaminophen, providing effective relief for moderate to severe pain. However, like any medication, Vicodin comes with its own set of potential side effects that need to be navigated with caution. In this video, we will explore the various side effects of Vicodin and provide you with valuable information on how to manage them. From common side effects such as drowsiness, constipation, and nausea, to more serious risks like respiratory depression and addiction, it is important to be aware of the potential implications of using Vicodin. We will also discuss alternative pain management strategies that can be considered, as well as precautions you can take to minimize the risk of side effects. By understanding the potential challenges and being informed about the proper usage and precautions, you can make informed decisions about pain relief options that work best for you. Join us as we delve into the world of Vicodin's side effects and offer insights on how to navigate pain relief with caution. What is Vicodin? Vicodin is a prescription medication that combines hydrocodone, a narcotic pain reliever, and acetaminophen, a non-opioid pain reliever. It is commonly prescribed to manage moderate to severe pain, such as post-surgical pain or pain associated with injuries. Vicodin works by binding to opioid receptors in the brain and blocking pain signals. Hydrocodone, the opioid component of Vicodin, can cause a sense of euphoria and relaxation, which contributes to its potential for misuse and addiction. Acetaminophen, on the other hand, helps to reduce pain and fever but does not have the same addictive properties as opioids. Vicodin is available in different strengths, and the dosage prescribed will depend on the severity of the pain and the individual's tolerance. It's important to note that Vicodin should only be used as directed by a healthcare professional and for the duration prescribed. Misuse or prolonged use of Vicodin can lead to addiction and other serious health consequences. Let's now dive deeper into the potential side effects of Vicodin. Common uses of Vicodin and potential side effects. Vicodin is commonly prescribed for the management of acute pain, such as after surgery or dental procedures, as well as chronic pain conditions like arthritis or back pain. It is important to note that Vicodin is not intended for long-term use, as prolonged use can increase the risk of side effects and dependency. Like any medication, Vicodin can cause side effects. Common side effects include drowsiness, dizziness, constipation, nausea, and vomiting. These side effects are usually mild and temporary, and they often subside as the body adjusts to the medication. However, if these side effects become severe or persist, it is important to consult your healthcare provider. In addition to these common side effects, there are more serious risks associated with Vicodin. One of the most concerning risks is respiratory depression, which is a decrease in breathing rate that can be life-threatening. This risk is higher when high doses of Vicodin are taken or when it is combined with other medications that depress the central nervous system, such as sedatives or alcohol. Other serious side effects of Vicodin include allergic reactions, liver damage, and hormonal imbalances. Allergic reactions can manifest as hives, difficulty breathing, or swelling of the face, lips, or tongue, and should be treated as a medical emergency. Liver damage can occur with prolonged use of high doses of Vicodin or when it is combined with alcohol. Hormonal imbalances, such as decreased testosterone levels in men or irregular menstrual cycles in women, can occur with long-term use of Vicodin. It is important to discuss any concerns or potential side effects with your healthcare provider to ensure safe and appropriate use of Vicodin. Risks and precautions when taking Vicodin. While Vicodin can provide effective pain relief, it is essential to understand and manage the associated risks. One of the primary risks is the potential for addiction and dependency. Vicodin, like other opioids, can be highly addictive, and prolonged use can lead to physical and psychological dependence. To minimize the risk of addiction, it is important to take Vicodin as directed by your healthcare provider and only for the prescribed duration. Do not increase the dosage or frequency without consulting your doctor. It is also crucial to be aware of the signs of addiction, such as craving the medication, using it despite negative consequences, and experiencing withdrawal symptoms when attempting to stop. Another important precaution when taking Vicodin is to avoid alcohol and other substances that can depress the central nervous system. Combining Vicodin with alcohol or sedatives can increase the risk of respiratory depression and other serious side effects. If you have a history of substance abuse or addiction, it is important to discuss this with your healthcare provider before starting Vicodin. They may recommend alternative pain management strategies or closely monitor your usage to minimize the risk of relapse or misuse. Understanding the potential for addiction and dependency. As mentioned earlier, one of the most significant risks associated with Vicodin is the potential for addiction and dependency. Opioids, including hydrocodone found in Vicodin, can lead to physical and psychological dependence when used long-term or in higher doses. Physical dependence occurs when the body adapts to the presence of the medication and requires it to function normally. When a person becomes physically dependent on Vicodin, they may experience withdrawal symptoms if they suddenly stop taking the medication or reduce the dosage. Withdrawal symptoms can include restlessness, anxiety, muscle aches, insomnia, and flu-like symptoms. Psychological dependence, on the other hand, refers to the emotional and mental reliance on Vicodin to cope with pain or to experience feelings of well-being. This can lead to cravings for the medication and a compulsive need to use it, even when the pain is no longer present. It is important to recognize the signs of addiction and dependency and seek help if needed. If you or someone you know is struggling with Vicodin addiction, reach out to a healthcare professional or addiction specialist for support and guidance. There are various treatment options available to help individuals overcome opioid addiction and regain control of their lives. Managing and minimizing side effects of Vicodin. While Vicodin can offer effective pain relief, it is common to experience side effects, especially when starting the medication or when the dosage is increased. The following strategies can help manage and minimize the side effects of Vicodin. Drowsiness. If you feel excessively drowsy, avoid activities that require alertness, such as driving or operating machinery. It may be helpful to take Vicodin before bedtime to minimize the impact of drowsiness during the day. If drowsiness persists or becomes severe, consult your healthcare provider. Constipation. Vicodin can cause constipation, which can be managed by increasing your fluid and fiber intake. Drinking plenty of water and consuming high-fiber foods, such as fruits, vegetables, and whole grains, can help regulate bowel movements. If constipation persists, your healthcare provider may recommend over-the-counter laxatives or stool softeners. Nausea. Taking Vicodin with food can help alleviate nausea. It is recommended to eat a light meal or snack before taking the medication. If nausea persists, your healthcare provider may prescribe anti-nausea medication to help manage this side effect. Other side effects. If you experience any other side effects that are bothersome or concerning, it is important to discuss them with your healthcare provider. They can provide guidance on how to manage or minimize these side effects or explore alternative pain relief options. Alternative pain relief options. While Vicodin can be effective for pain management, it is not the only option available. There are various alternative pain relief strategies that can be considered, depending on the nature and severity of your pain. Some alternative options include physical therapy. For musculoskeletal pain or injuries, physical therapy can be beneficial. A trained physical therapist can provide exercises and techniques to improve strength, flexibility, and function, thereby reducing pain. Non-opioid pain medications. Non-opioid pain relievers, such as nonsteroidal anti-inflammatory drugs, NSAIDs, or topical analgesics, can be effective for mild to moderate pain. These medications work by reducing inflammation and targeting pain at the source. Complementary therapies. Complementary therapies, such as acupuncture, massage, or chiropractic care, can provide pain relief and promote relaxation. These therapies can be used alone or in conjunction with other pain management strategies. Cognitive behavioral therapy, CBT. CBT is a form of psychotherapy that focuses on identifying and changing negative thoughts and behaviors. It can be useful for managing chronic pain by helping individuals develop coping skills and resilience. It is important to consult with your healthcare provider to determine the most appropriate alternative pain relief options for your specific situation. They can assess your pain and medical history and provide personalized recommendations to help you manage pain effectively. Tips for safe and responsible use of Vicodin. To ensure safe and responsible use of Vicodin, consider the following tips. Follow the prescribed dosage. Take Vicodin exactly as prescribed by your healthcare provider. Do not increase the dosage or frequency without consulting them. Avoid alcohol and other substances. Do not consume alcohol or other substances that can depress the central nervous system while taking Vicodin. This can increase the risk of respiratory depression and other serious side effects. Do not share your medication. Vicodin should only be used by the person for whom it is prescribed. Sharing Vicodin with others is illegal and can lead to serious health consequences. Store Vicodin safely. Keep Vicodin in a secure location away from children and pets. Dispose of any unused medication properly according to local guidelines. Keep track of your medication usage. Maintain a record of when you take Vicodin to ensure that you are not exceeding the prescribed dosage or frequency. This can also help you monitor the effectiveness of the medication and identify any patterns or concerns. Remember, open communication with your healthcare provider is essential for safe and effective pain management. If you have any questions or concerns about the use of Vicodin, do not hesitate to reach out to them for guidance. How to talk to your healthcare provider about Vicodin. If you are considering using Vicodin for pain relief or have been prescribed Vicodin and have concerns or questions, it is important to have an open and honest conversation with your healthcare provider. Here are some tips on how to approach this discussion. Prepare for the conversation. Before your appointment, gather information about Vicodin, its side effects, and any concerns or questions you may have. This will help ensure that you cover all relevant topics during your discussion. Be honest about your pain. Describe your pain accurately, including its severity, duration, and how it impacts your daily life. This information will help your healthcare provider determine the most appropriate pain management options for you. Ask about alternative options. Inquire about alternative pain relief strategies that may be suitable for your condition. Discuss the potential benefits and risks of Vicodin compared to other options. Discuss your medical history. Inform your healthcare provider about any past or current medical conditions, as well as any history of substance abuse or addiction. This information will help them make an informed decision about prescribing Vicodin or exploring alternative options. Address your concerns. If you have any concerns about the side effects, risks, or potential for addiction associated with Vicodin, express them to your healthcare provider. They can provide information, reassurance, and guidance to help you make an informed decision. Remember, your healthcare provider is there to help you manage your pain and make informed decisions about your treatment. By having an open and honest conversation, you can work together to find the most appropriate pain relief options for your specific needs. Resources for support and information on Vicodin use. If you or a loved one is seeking additional support or information about Vicodin use, the following resources can be helpful. National Helpline for Substance Abuse and Mental Health Services. This helpline provides 24/7, free, and confidential treatment referral and information service for individuals and families facing substance abuse and mental health disorders. They can provide assistance in finding local resources and support. National Institute on Drug Abuse, NIDA. NIDA offers a wealth of information on opioids, addiction, and treatment options. Their website provides resources for both individuals struggling with addiction and healthcare professionals seeking evidence-based information. Recovery.org. This online resource offers information on addiction treatment, recovery support, and treatment centers. They provide a directory of treatment centers across the United States, making it easier to find help in your local area. Remember, seeking help and support is a sign of strength. If you or someone you know is struggling with Vicodin addiction or dependency, reach out to these resources for guidance, support, and treatment options. Conclusion. Balancing pain relief and caution with Vicodin. Vicodin can be a valuable tool for managing pain when used as directed and under the guidance of a healthcare provider. However, it is important to be aware of the potential side effects and risks associated with its use. By understanding the common side effects of Vicodin, recognizing the signs of addiction and dependency, and taking precautions to minimize the risk, you can navigate pain relief with caution. Additionally, exploring alternative pain relief options and discussing them with your healthcare provider can help you find the most appropriate and effective treatment for your specific pain condition. Remember to use Vicodin responsibly, follow the prescribed dosage, and avoid alcohol and other substances that can interact with the medication. If you have any concerns or questions about the use of Vicodin, do not hesitate to reach out to your healthcare provider. They can provide personalized guidance and support to help you manage your pain effectively and ensure your safety. Thanks for watching.